Hi, today we're going to talk about appointments and appointment management system, and these rules are going to be used for whether the office still uses an appointment book, manual appointment book, or digital. These are just your basic rules for it. So what is the appointment? It's the list of all the schedules for the patients and the events for the dentist and the staff. So it also will include like staff meetings or holidays or anything, not just the patients. And the appointment control is used to maximize productivity and to maintain concern for patients' needs, what patients you should see when, what's the best for them, and how to best take care of your patients. So a paper appointment book might look like this. It's printed with and without dates. You might have one or more columns for each operator. So in some offices it might just be one doctor, and other offices might have 4 or 5 doctors that you have to control. And you might have multiple rooms. You might have 11 rooms going at once. Who's in all these rooms along with the hygienist and everything else? So the days are divided in time increment, and you can either have like 15 minutes or 10 minutes. That's pretty common. Um, and these, like I said, these are kind of being phased out as we go to more and more computer software. So the matrix, that's the framework that your appointments are booked around, and this is completed before new appointments book is used. So if you get a new book, or if you're going to set up your matrix on your computer, you want to set it up accordingly. For example, if they always have lunch from 12 to 1, you're going to block that time out so you don't have patients. If your office hours are 8 to 5, you're going to block off anything before 8 and anything after 5. You also will block off times for holidays, staff meetings, just when your office will be open, and vacations. So you want to look way ahead down the time. And then buffer time. So this is a really good idea to have. Not all offices do this, but it really helps to have usually about 20 minutes sometime. Sometimes they'll put it in twice a day, sometimes just once a day. And this is just for an emergency. So you have that time built in. So your routine patients, you're not going to jam every single appointment, because you're going to leave a little bit of room there because you know emergencies are going to come up. The emergency patient. Um, so when they call, the triaging of this is extremely important. So asking them questions. How long have you been in pain? Are you sensitive to hot and cold? Is it pressure sensitive? Any swelling? So if they are an emergency, if they have an infection, they have to be seen. They have to be seen, period. If they have a lost filling or a tooth broke off, but there's no pain or anything else, that you can postpone for a day or two. But anything that has to do with infection, they have to be seen. A young child. So early mornings are usually better. Consider their nap times, their meal times. After school hours are most popular. So if you have a 3-year-old, a 4-year-old, you want to try to get them in the morning. Older adult patients, of course, they also require special attention. So they may be slower. You're going to work out. You don't want to have after 3 o'clock is a very rush time in an office. And so you want to also try to get your older patients in earlier, and you want to consider things like, are they diabetic or whatever. So you don't want to book them probably during lunchtime. So you have to just get to know your patients and find the best time for them. The prime time, like I said, is frequently after 3 o'clock when school gets out. That's the busiest time. Patients normally will say, I can come in early or late. So during the middle of the day, you want to fill it with people that might not have to work. Um, so if you get a patient that is always late, you'll get to know your patient. So they recommend that you confirm this 15 minutes earlier. So if their appointment is really at 9 o'clock, but you're going to tell that patient that it's at 8:45, because they'll be late and then they'll be right on time for you. If a patient arrives on the wrong day, you have to kind of determine who's at fault here? Is it the patient's at fault or is it the office? If it's the office at fault, you really have to see that patient. Unless they're, surgery, a 3-hour surgery, then of course you have to change that. But if it's a half an hour appointment and it's your fault, you got to kind of try to squeeze them in. If it's the patient's fault, then by all means try to accommodate them, but if not, reschedule. Drop-in and walk-ins, you want to discourage this. If it's an emergency, yes, they have to be seen. So if they do walk in and they're holding their face and it's swelling and they're in pain, yes, you have to see them. That's legal. You have to. It's against the law to not see a person in pain. If it's a routine appointment, explain to the patient that they have to make an appointment. Broken appointments or no-show, you want to always document this. And if a patient is always no-showing, the office could decide to terminate this patient from their practice. Dovetailing, this means double booking, and so you might have Mrs. Jones in room 1, but while her anesthesia is working, you could book somebody at the same time off a little bit for something simple or quick like suture removal, impressions, an emergency. An emergency, if it's an x-ray and a prescription, that doesn't take long. If it's a whole broke off the front tooth and you have to do a root canal, a pin, and a build-up, you're looking at 2 hours. So again, it's really important to find out why people are coming in. So you're going to make the appointment. Avoid open-ended questions. Ask the patient what day and what time of day. So if you just leave it open, when do you want to come in, that leaves too many options. So if you start off like, what day works best for you? I have openings on Monday and Wednesday. I have a 2 o'clock, a 5 o'clock, and kind of like just give them a couple of options, and it just gets you, frankly, in and off the phone quicker. These bookings appointments rules apply regardless if the booking's on paper or computers. So you will practice both on paper and in your Dentrix. Thank you.